Herniated disc is in layman's term, a slip disc. What that is the cushion between the two vertebrae. That cushion, for lack of a better word, breaks off, a piece of it slips out, and it starts pushing on a nerve. What we feel is the mechanical pain of that breaking out of the disc, and that's where you feel the back pain. And in the lower back, you'll feel pain going down the leg from the nerve being pinched. So the main culprit is that little piece of disc material breaking out and pushing on that nerve. The treatment of the condition depends again on how much you're suffering, how long you've had it, your exam, or do you have any weakness in your leg, do you have any bowel and bladder dysfunction, and those kinds of things. Generally, what you try to do is start with minimal treatment like physical therapy. Depending on how you respond to that, I always start from the basics and kind of work my way up. And so anti-inflammatories are very important, the non-steroidal anti-inflammatories. Pain medicines sometimes are required. And if everything fails, that's when, and if everything's been tried and you fail, then you think about surgery. The surgical option for a slip disc or a herniated disc is now done almost exclusively with a microscope. And the idea is finding the nerve root, and if I may, the nerve root should be nice and free and loose in the breeze, if you will. It's typically, instead of being like this, it's kinked. And it's kinked because underneath you have this sliver of material that I like to compare it to crab meat. And that crab meat is pushing on that disc, on that nerve. We pull the nerve over and take the disc out. And it's usually done with a very small incision. The surgery for the herniated disc typically takes an hour, a lot of times less. And the recovery, as far as being hospitalized, it's getting to the point where a lot of patients can go home that same day or at the latest the following morning. You hear a lot of people are afraid of back surgery, but please understand that everybody is different, and there's lots of different surgeries that are being put in this grab bag of back surgery. What we're talking about now as far as disc surgery, that has a very high likelihood of improvement, of folks returning to their normal lifestyle, normal work, without any limitations and without any pain. The recovery for this is generally, as I said, 1 day hospitalized. Usually within 2 weeks, you're back at work and doing pretty much everything. Obviously, a lot of folks have a little bit of soreness in your back as you're still recovering, but it's usually very self-limited.